Hello and welcome to the Society with Fatma Shaheen at PTV World. Considering unfortunately that Pakistan still happens to be one of those very few countries all over the world who happens to still suffer from polio cases, today we'll be talking about the very imminent, rather the pressing need to eradicate polio from our society. In this regard, it's very important to mention at the outset that Pakistan started its first nationwide polio eradication campaign in the 1990s, more specifically 1994. From 1994 to 2022, how far have we come? Where did we get lost in this momentum? This is something that we'll be talking about. We'll also be talking about the various challenges that we have faced in successfully implementing this campaign, be it challenges which are coming forward in terms of actually educating people on the very pressing need to actually get their children vaccinated, or for those which have occurred in different circumstances, those coming from frontline healthcare workers, and more recently in the current catastrophic floods that we are all faced with. We'll be talking about the need to overcome these challenges, and when we talk about polio eradication, why this is something which just shouldn't stem from the government. This is something which should also stem from the community equally too. This and much more to follow on today's show, and to do that, let me introduce you to my today's panel. My first panelist for the show today is Dr. Muniba Kamran, who is a developmental pediatrician at Children's Hospital. Assalamu alaikum ji, and welcome to the show.
Thank you for having me.
My second panelist for the show today is Dr. Naeem Majid Saab, who is the technical focal person for Immunization. Assalamu alaikum ji, and welcome to the show.
Welcome, Salam, and thank you.
And my third panelist for the show today is Ms. Sayyida Ramla Ali, who is the Deputy Secretary, PSHT Coordinator, Emergency Operations Center for Polio Punjab. Assalamu alaikum, madam, and welcome to the show.
Welcome, Salam, and thank you for having me.
Madam, to get the conversation started with you, I think we must start with the very basics. When we talk about the polio virus, can you tell us, for the clarification of the audience, that what particularly causes the disease, and what types do we have largely?
Polio is basically a very contagious virus. It has got 3 strains, type 1, 2 and 3. 2 and 3 have been eradicated globally, while type 1 is prevalent. And as you have said, that Pakistan is one of those 3 countries who are still endemic for polio.
Other than Afghanistan and Nigeria?
Other than Afghanistan and Nigeria. Polio eradication was considered a global initiative and was declared a global emergency in late 90s. And the Global Eradication Polio Act was introduced in 1994. In Pakistan, the polio eradication campaign was initiated in year 1994. However, we have still not achieved efficacy in the vaccine campaign across Pakistan. And the major and most important cause amongst it is the parents' unawareness and their refusal towards vaccination.
Right. I think this is something, madam, on which you would be able to comment, because we understand the fact that Pakistan initiated its first nationwide polio eradication campaign in 1994. 1994 to 2022, we have of course come a long way, but how persistently do you see this very issue being there? Because I think this is a very rampant issue that we do see, that people still in Pakistan, more so the parents, more so the caregivers, they are reluctant to give their children vaccinated, because they feel, if not anything, when it comes to induce female infertility.
And there are a lot of misconceptions and misinformation related and surrounding the whole polio vaccination campaign. But I would just like to add that there are certain vaccine preventable diseases, and polio is one of those. And initially we didn't really have a door-to-door campaign. It was mostly a static center, like a health center, where all the children would go and get vaccinated. But in 94 onwards, we started a door-to-door campaign to encourage the fact that health facilities go to the door of the house and encourage people to vaccinate or inoculate their children. Currently, we do feel that yes, people have misconceptions, because the first reaction is, like all vaccination, the child will get a fever, the child might get sick. So the first reaction parents have, we do not really want to vaccinate. But polio itself, the vaccine does not really have any negative impact or side effects for anybody. Even for sick children who are suffering from flu or a sore throat, they are inoculated and administered the drops, just because it is an added immunity that we are giving.
Right. Madam, your point is noted. Sir, I would want you to basically comment on this further too. When we talk about the side effects of the vaccination, what do you feel are the most glaring side effects? Because we have seen studies where people have actually come forward with this complaint that, once they have gotten themselves vaccinated. They hear, different kinds of noises in their ears and, so many other symptoms that they can possibly in that way suffer.
Yeah, so like any other medicine or even foods, which like people have food allergies as well. So vaccines are also something which we are giving from outside the human body. So their reactions are always expected. But it is not necessary that every person will get a reaction. And talking specifically from polio vaccine point of view, the polio vaccine is very safe, one of the safest vaccines, and the side effects are usually very mild, sometimes like low grade fever or diarrhea or things like that.
That is something that we see even in the case of the COVID-19 vaccination. Remember when the vaccine came, there were so many apprehensions surrounding it. There were so many, kind of myths which we needed to dispel, and today we are where we are.
But still, compared to the COVID vaccine, the polio vaccine is much safer.
Of course, sir, your point is noted. Coming to you, madam, I understand the fact that Pakistan, in Pakistan, like you very rightly so mentioned, the two types of polio strains, type 2 and type 3, that has been eradicated. Now our fight is against the strain of type 1, so to speak. But at the end of the day, I think a very important question, which is, and I would want you to clarify this further, is that there is a variance of symptoms that we often see in patients. There might be patients who might just have very mild flu-like symptoms, then there are patients who are completely asymptomatic, and then we've also seen polio possibly disabling people for life. So how do you as a doctor explain this, by of course virtue of science, that somebody can fall so ill because of contracting the polio virus and somebody can be so fine?
Approximately 90 to 95% of the polio infected children, they do not show any symptoms. They do not have any apparent illness. But since they are infected with the deadly virus, they are transmitting the disease. So their neighborhood and their close contacts, they are all at risk of developing the disease. Another 5% of the population develop mild fever like fever, sore throat and myalgias, and they may also experience serious life-threatening CNS infections in the form of seizures, coma, aseptic meningitis or encephalitis.
So is this basically because their general immunity is not that good, or is it because they are malnourished? Like, what reasons would you attribute to somebody being falling more severely ill as opposed to somebody else?
The nutrition status and the immune status of the person is very important. A pregnant lady, people who are on steroids, the immunocompromised patients who are on some sort of chronic debilitating conditions like HIV, they are more prone to get disease.
Right. Madam, coming to you, I think we must also talk about, of course, this whole campaign of yours, which you are very successfully running, more so heading and spearheading rather in Punjab, which is, of course, formed an example for other provinces too. So tell us about it. I understand it's by the name of NIDS. How practically does it emancipate? What all is its scope, and how effective has it been practically in eradicating polio?
The provincial EOC, that is the Emergency Operations Center, has its federal center also at the national level in Islamabad, which is supported by the Federal Ministry of Health, and it generally plans the number of national immunization days that we conduct across Pakistan for the year. So currently for this year, we've had 4 national campaigns and 3 sub-national campaigns planned, and we've already conducted our 3 national campaigns of this year in March, May and August also. The purpose of the national campaign is to ensure that all children under the age of 5 and newborn to the age of 5 are all immunized with OPV, oral vaccine, to develop a certain level of immunity against the virus.
Right.
And the blanket and sweep effect will kind of nullify the negative impact of the virus on children, and the success has been large scale. If I count from 1994 onwards, our peak period has been in, I think, 2014-15, when we had more than 200 cases in across Pakistan.
Right.
But Punjab itself has been polio free.
I was about to say that, compared to the other provinces, Punjab has relatively shown more success in eradicating this disease. But at the same time, I think a very basic question to ask in this regard, and I think something which would be of interest to the audience, is that like, what kind of plans do you have in mind before you actually send the polio workers out, that this is the population that you need to target, these are the mechanisms that you need to use, because I'm sure a lot also goes into training these polio workers, because it's not that easy a job, more so I think in the current devastation, unfortunately, which the country is witnessing.
Truth, for every campaign that we start, it's a 5-day campaign that is conducted across the province or across the country, and the planning is starting from like 3 weeks before the campaign is starting. So we start with the micro plan making, where we have the plan of the mahalla or gully where the houses are situated, the number of children that are going to be vaccinated. For Punjab, we have 22 million children approximately under the age of 5 which are inoculated in every campaign. And for that purpose, we have around 200,000 frontline workers, including our area in charges, UC level monitors and provincial level and district level monitors, who are encouraged and take part in the whole campaign process. There are training aspects. Everybody is given a 2-day training. In the process, what they have to do, the frontline worker is mostly a lady health worker or a volunteer.
I was about to come to that, because a lot of times we see that this inhibition to get their children vaccinated also stems on the parents' part, because they feel that a female worker is perhaps not doing it. So I think all these things, they stem from the society. A lot of times we see that people are just not comfortable getting their daughters perhaps vaccinated, because they do for some reason feel that this might lead to infertility later on. So I think in that regard, you need to educate, you need to sensitize the frontline worker, so that they in turn can pass on that knowledge to whoever is actually questioning all these issues. But sir, coming to you, do you not feel now that the challenges, the dynamics of the challenges of the polio eradication campaigns, they would completely change, more so given the current circumstances, more so given the fact that of course now we are faced with this catastrophe of floods? Because recently I was seeing this video, and it was something which was very commendable, that this polio worker in Punjab, he was actually swimming through water to get to his desired house to actually vaccinate children. So how can we work on these issues, considering now that of course the infrastructure and many such issues of accessibility might arise?
Yeah, so whenever there is a catastrophe, so the campaign is definitely affected. Like it was affected in 2005 earthquake, then in 2010 floods, 2014 floods, and now again. So because it does any emergency, it disrupts the routine programming, whatever is there. And the campaigns, since they are planned in these areas as well. So in order to address this specific challenge, whenever we set up camps in those areas, we set up an immunization counter over there as well.
Okay.
And that counter has OPV vaccine and all the other vaccines for children.
Right, sir. I think we must also talk about, of course, the very important work of international organizations in this regard, because we do understand that UNICEF and WHO and quite a few other global partners have also been working with Pakistan and the Pakistani government to eradicate polio, and you yourself had that advantage of working with quite a few various organizations. So tell us practically that how does it all work? Is their work just limited to procuring and distributing vaccinations, or does it also extend to communication, advocacy, community engagement?
Yeah, so polio is an international problem, so there are many organizations who are working with us, who are supporting the government of Pakistan and also working independently as well. So there is a global polio eradication initiative, GPEI, and there are many member organizations of that initiative, including UNICEF, WHO, Bill and Melinda Gates Foundation, Gavi, and Rotary International, and also many others. So these organizations, all of them, they have their own roles. Like UNICEF is more focused on communication, WHO on technical support, monitoring, and independent surveys.
I remember UNICEF is also very focused on the vaccine management.
Yeah, so UNICEF is also supporting on the supply chain. For example, the cold chain, the ice line refrigerators, they are all procured and supplied by UNICEF.
And I think a very important consideration then remains is to keep the vaccinations safe too, because again that is also a very pressing concern. Coming to you, madam, I think talking about vaccinations, it's very important for us to talk about the fact that when we talk about vaccinations, we see that world over there are two ways in which this vaccination is actually administered. One is OPV, that is the oral polio vaccination, and the other one is injectable, which we often see being used in USA. So in Pakistan, what is the common practice? What kind of injections, what kind of vaccinations are being used to eradicate polio, and how effective are they if you were to make a comparison?
Both the vaccines are available, and both the vaccines are part of the EPI.
Okay.
All the developed countries, they have discontinued use of OPV, oral polio vaccine. The fact, first of all, I would like to educate a little about IPV and OPV. IPV is an activated polio virus that contains dead virus, while the oral polio vaccine contains the live virus. Now the live virus within the oral polio vaccine, it is administered again, and it works with the same principle as the poliomyelitis does. It gets multiplied within the mucosa of the gut, but it is not allowed to cross the CNS and does not cause disease or paralysis. It is shed within the feces, and in addition to imparting immunity to the child who is being immunized, it also confers immunity to the neighborhood and close contacts. So it is very useful for herd immunity. While IPV, it only provides increased antibody response within the person who is being immunized, and it is very effective. 2 doses provide 90% protection against polio, while 3 doses provide 99% protection against polio.
Right.
Why developed countries have given up use of OPV is because of the fact that this vaccine is sometimes associated with vaccine-associated poliomyelitis, which is a rare entity. It is present only in 1 out of 5 million cases of the vaccines that were administered.
Right, madam, your point is noted. On which I'll come to you, madam. I understand the fact that a directive has been issued with regards to, of course, carrying forward with this polio eradication campaign, more so in the current catastrophic flood devastation that the whole country is now faced with. So how practically are you people planning to go forward, because we can't ignore the fact that, of course, this is going to be a very difficult task?
Our frontline workers are mostly female. We have health workers, we have LHVs, and then we have volunteer female students or different age groups coming out and assisting us in inoculating children. The purpose being the fact that since the mother of the child is at home and females get an easier accessibility to the child being going inside and inoculating, hence we promote the fact that females should come forward for the purpose.
Right.
But in the same breath, I would like to add that they do face resistance because there are random incidents of violence, abuse by the parents and misbehavior, wherein we step forward with the assistance of police service, and then we have the police come forward.
Really?
Yes, and they register FIRs.
What area was this, and why would they want to call the police for this? They could just say no to you.
True. The fact is that since we've had repeated campaigns, people kind of have misunderstandings and misconceptions, and if something personally is going on at their own level, psychologically, or a family issue is going on, somebody who comes on the door gets the brunt of that issue.
Right.
So recently in the area of Gulbarg, we had such an issue wherein the parents abused the lady health worker.
Right, madam, your point is noted. On which, sir, I'll come to you. I think we must also talk about this repeated need for us to basically ensure that our children are vaccinated, because I think a very common misconception in the Pakistani society is that once you have gotten your child administered with the polio vaccination, that's enough, and that child is then good to go for the rest of their life. So please do clear that, and also tell us that at what instances, after how much time do we actually need to get the child vaccinated in order to ensure that, of course, the polio dose is complete.
For the individual's immunity, it is like 3 times is more than enough, but that is the injectable vaccine, the IPV, which is given. So in Pakistan, our EPI program is currently giving 1 dose, but we are planning to introduce 2nd dose as well, and then inshallah gradually we will be adding the 3rd dose as well. But for the overall community, when we look at Pakistan, we are an endemic country and we are posing a risk to other countries as well. So in such situations, we need to go with repeated campaigns of OPV as well, which is the oral polio vaccine. So that is basically, as you also mentioned and Dr. Saab also mentioned earlier, that it prevents the transmission, it breaks the transmission chain. So to break that transmission chain, we have to give this polio vaccine, and it has to be given at one time across the whole country, or ideally across the whole.
And then, of course, I remember there was this campaign that was run by the government, NIDS, correct me if I am wrong on this, which was actually ensuring that the time at which Pakistan was carrying forward with this campaign, Afghanistan was also replicating, because considering, of course, that we have a porous border, and Afghanistan is also, of course, like us, not a polio-free country, so that even if people do cross borders and there is, of course, mobility that way, we ensure that people at both ends are taken care of. So tell us about this, because I think this is something very strategic, rather it's very intelligent, that the time at which people in Pakistan are being vaccinated against this disease is the same time at which people across the border in Afghanistan, they are also being vaccinated.
Understood the fact that herd immunity is something that is to be developed at a large scale, and there's a lot of porous movement between Pakistan and Afghanistan at Chaman border, at KPK borders also. So we encouraged this time around in May, when we had our national campaign for Pakistan, we conducted a similar campaign. The Afghanistan side also conducted a campaign to encourage that all children under the age of 5 are also inoculated. But for Afghanistan and Pakistan movement, at our borders, we are giving vaccine to all adults also traveling.
Right, your point is noted, on which I'll come to you, Doc Sahib. I think we must also talk about this very relevant point that, Madam has raised, that we have seen cases where basically adults have also come forward, complaining that they do suffer from the disease. In some cases, we've also seen that, adults have actually been paralyzed because of suffering from the polio virus disease. So, as a doctor, how do you explain this? Because more often than not, I think a general conception in the Pakistani society is that only children suffer from polio.
No, it's a misconception. Polio is a disease that can infect any person at any age.
Right.
It does not have any boundaries, as you have said so. Whenever a person is immunocompromised, he has low immunity, low protection against the deadly virus,
Right.
he'll get the disease. For example, a pregnant woman can easily get the disease. A person who is on steroids, a person who is suffering from...
Is there a predominance in males too? Because I think there are studies to suggest the fact that, males, if not vaccinated, are more prone to contracting polio as opposed to women.
Actually, polio affects male child and female adults. So, whenever there is immunosuppression, maybe in the form of steroids, maybe in the form of immunosuppression drugs, like drugs from malignancies, from the treatment of cancers, the person may contract polio at any age group. And also regarding the activation of polio at a later age, if there is infection from polio at an early age, this polio virus gets reactivation later on in life, and it causes signs, symptoms like muscle weakness, new onset paralysis, numbness in the patient who was previously infected with the polio virus.
Right, madam, your point is noted, on which I'll come to you, sir. I think we must also talk about this, that when we talk about polio, we have seen that of course Pakistan has come a long way, and that is something which we very rightly so explained earlier during the conversation. But when we talk about it, of course, in comparison to other diseases like smallpox, as we all understand, has been eradicated world over, and that is considered to be a very big achievement. But in the case of polio, why do you feel have we not been able to do that? Has it been a mix of biology, or do you feel that it's psychology that we need to blame?
Smallpox, was comparatively easier to eradicate because the vaccine was an injectable vaccine, and it was like a lifetime immunity for whoever gets that. And during those times there was not so many misconceptions about vaccines. Even if there were, they were not so widespread, because with the presence of the social media and easy communication, that spread of fake news and these false information has become more common. So due to this, we are now getting more refusals due to myths and other things which was previously not there.
I think media here is such an important role to play, especially when it comes to putting forward the right information.
I would like to add here the fact that recently we had a social media outbreak of such a misconception. It had a small clip of the fact that the polio workers have gone to vaccinate the family, and the mother comes out and she generally starts yelling at them that I don't really want to vaccinate the child because it causes diarrhea, and I'm done having dealing with diarrhea of my children. So we took a fast forward reaction, and we tried with Facebook, and we reported the video clip just to ensure the fact that a little access to such misinformation can cause have large scale effects.
It completely changes your narrative, madam, at the end of the day. So I think in this regard, the media, again, I think they have a very responsible role to play here, that they make sure that they get forward the right information, the accurate information, rather than just twisting facts. I think here we must also talk about the fact that when we talk about the community engagement, because I think you are that one person who has that direct access to the community, since you are leading this campaign in the whole province, Punjab, so to speak. Why is it so necessary for us to actually engage the entire community? Because world over, if you see, countries who have been successful in eradicating polio have taken their people along.
The fact is that there are always anti-vaccine people across the globe, whether it is COVID or whether it is polio. And to develop a circle of influencers and public opinion makers is very essential to kind of cull the fact, the misconceptions related to the vaccine. And hence we conduct community engagements, be it ethnically community engagements or the religious or social setups that we have. It is not only that we have refusals or misbehavior from low level income people, we even have very poor society people who do not like to vaccinate the child over and over again.
What are the most common, attitudes that you come across? Because as a pediatrician, I understand that you do come across a lot of people, more so families, I think the ones that she's been referring to. So why are people so hesitant to start off with? And I think this is something very relevant that she pointed out, that it's just not always the uneducated people, it is also the educated people who are actually hesitant to get their children vaccinated.
there were religious misconceptions that the vaccine contains haram contents like pork fats, like alcohol. Then there were families who were concerned that this vaccination results in infertility among children, and it is more associated with birth control. And then there were mothers who were concerned, who were again got knowledge from social media or some God knows where, and they thought that this vaccine is going to predispose their child to conditions like diarrhea, to common cold, as well as malignancies. So there was whole research why. In 2015, Pakistan Drug Regulation Authority proved that the vaccine contains no such ingredient, and also there has been input from the religious scholars. There is fatwa available from the Jamia Naimia, whose students also have conducted various researches, and this vaccine is considered totally halal for all the Muslims, and it does not contain any birth control ingredient.
Right, madam. I think, sir, we also have a set code of, immunization policies and laws, at least to the extent of Khyber Pakhtunkhwa, when it comes to actually carrying forward with this whole polio eradication program. So tell us more about that, what are the do's and what are the don'ts as per the policy?
Okay, so globally, if we look at the countries, so there are three types of laws about immunization. So some countries, they have mandatory immunization policy. Some have immunization policy that it is mandatory before admission to the schools. So if your child is to go to school, you have to get the vaccination, otherwise you don't get admission. And there are some countries who just say that vaccination is recommended and they don't force it. Coming to Pakistan, our national immunization policy, it says that every child has to be vaccinated against all the vaccines included in the EPI program. So the policy is there, but we don't have a law, national law, which mandates the government to take action against the people who are not getting.
We have a law in Khyber Pakhtunkhwa.
Yeah, so I'm just coming to. We don't have a national law. We have a provincial law in KP, where they have even prescribed some punishments for people who refuse, like they have fines up to 10,000 rupees and some imprisonment as well. But in other provinces, this law is not yet available. But the departments of health, they are working on making such laws and getting them approved in Punjab as well as in Balochistan and Sindh.
I think strict promulgation and of course followed by effective implementation, that will definitely help us actually make all these polio eradication campaigns more successful. Madam, coming towards you and to conclude today's show, what would your takeaway message be to wrap up today's conversation, especially when it comes to moving forward and of course surpassing all the barriers that we do currently face when it comes to vaccinating our children against the polio virus?
Like we started with the program, we mentioned that prevention is the best cure. So all vaccines, preventable diseases can be prevented if you vaccinate your child. We have a chart of 12 diseases for the EPI, and polio is part of that chart.
Right.
For our flood affected areas, I would like to add for all people's information is that it is an oral fecal disease. So hence, since people are now living in flood camps, they don't really have access to clean
no
water,
no
sanitation, no washrooms to go to. So hence we are encouraging in our all health camps to give out tabs so that people can chlorinate their water and use that. Soaps for washing after visiting washrooms. But we will be also conducting a special campaign in all these flood affected areas. We have set up health camps, and the directive is to give OPV and IPV to children under the age of 5 and 2 respectively, to encourage and immune them against the disease.
Right.
But for general population across Punjab and Pakistan, the message is that parents should be willing to vaccinate their child every time the teen comes to their door, and not really pose any resistance to them, because one way or the other we do not enforce them or use coercive measures, but we do bring in influencers and family members to encourage them to go back to the vaccination.
But then at the end of the day, there is little you can do if the other person is not willing to listen to you. You can't, of course, force somebody. All you can do is it's just polite persuasion. That is, and I think in this regard, again, no matter how much we stress the role of the media, I keep on saying again and again, that becomes very pivotal here, because media is that fourth pillar of the estate, which has to educate people. It has to sensitize people about these very issues. Sir, coming to you, what would your take home message be in this regard, to wrap up today's conversation? So what would your message be to all those people out there, especially when it comes to giving them the right advice in the current circumstances, the current catastrophe of floods that we are all faced with, that how precisely can they, against all odds, make sure that the children are vaccinated?
So my message would be that the parents should not wait for our teams to reach them. They should actively seek out and get their children vaccinated. according to the schedule. So even if the vaccinator is not coming to their area, the radial health worker is not coming in their area due to any reason, be it flood or any other, so they should actively seek the vaccination service from our fixed health centers as well. So the vaccines are available at all the basic health units, all the rural health centers, all the hospitals in the public sector, and even we are now trying to have this free of cost vaccination provided at all the private hospitals.
Right. And
well.
also I understand the fact that there's a very strict monitoring mechanism as well when it comes to the frontline healthcare workers, something which you were earlier telling me as well, madam, that basically you make sure that people who set out to actually vaccinate, they actually do it. So I think considering that you are getting this, considering that there is a very strict check and balance on this, I don't see any reason why you should not vaccinate your child.
There is a helpline as well from the federal government as well as from the government of Punjab. So if you have any question about polio vaccination or any other vaccination, so you can just dial 1166 or 1033. It is free of cost call from all mobile providers, so you can call and get further information whenever you need.
Right, sir, your point is noted on, which I'll come to you, madam. So what would your suggestions be, especially when it comes to doctors like yourself, pediatricians like yourself, playing their due part when it comes to, of course, eradicating polio virus? Because at the end of the day, I feel this is just not an individual responsibility, it is a collective responsibility which is vested on all of us, including doctors like yourself.
So pediatricians can play a very important role in educating the families, since I think families are very receptive to their pediatricians, and pediatricians should communicate to the families that as long as their child is safe, he is safe from all the physical disabilities. And not only when the child gets polio, he will not be physically disabled, but there will be psychological and social challenges that the child as well as the family is going to face. The child suffering from physical disability will suffer from low self-esteem, he will suffer from anxiety, there will be depression, he will be socially withdrawn from the society. And for the parents, they will also be stigmatized, they will also be socially withdrawn. So, and also there are going to be financial challenges if their child, God forbids, contract poliomyelitis. So, pediatricians on the forum of Pakistan Pediatric Association, they also advocate the role of polio vaccination, and they encourage parents and their families regarding administration and reception of vaccination.
Definitely, and I think this is a momentum which must continue, because I think which you very rightly pointed out that it's just not about getting yourself polio free, it is also about coming with a lot of other things, social implications, psychological implications, and it just impacts and changes your life completely at the end of the day. I think for that, parents themselves need to be educated, they need to be sensitized in this regard as well, because it's not always per se the illiterate or the uneducated families who are opposing this, it's also the educated ones.
Pediatricians can avail the opportunity to discuss regarding vaccination with the families, as families are very open to pediatricians and they take their advice very seriously. Also, it is duty of the pediatrician to tell the parents that polio is not a treatable, not a curable disease, but the financial implications once a child gets poliomyelitis is a lot. Not only the parents will face the financial implications, but they will also be stigmatized from the family.
Of course, the social impact, the psychological impact of it is so much, because at the end of the day, if you end up contracting the virus, God forbid, and if it ends up being serious, then you're disabled for life. And of course, living with a disability, as we all understand, is extremely difficult, and it does come with own sets of challenges.
We need to tell the families that as long as one child is infected with polio, the whole world is at risk of contracting the disease.
Right, as they very rightly so put that ending polio is generally for the common good, of course, the entire world at the end of the day. On which note, I would like to conclude today's show. Thank you so much, Ms. Sayyeda, thank you so much, Dr. Saab, and thank you so much, madam, for being here with us today. We generally spoke about polio awareness and of course the need to eradicate polio in our society today. In this regard, we also spoke about the very pivotal role of government, all that the government is doing. We spoke about the need to engage community, especially when it comes to making Pakistan polio free. At a very basic level, we all need to understand the fact that nobody is safe until and unless everybody is safe, and this is something that we also need to practice in letter and of course in spirit too. On that note, signing off for today. Until next time, take care and Allah Hafiz.